So today we are going to talk about an important topic, that is headache. Okay, this is also a common complaint which will experience the patients or any person once in a lifetime, or nowadays it's the most common and most seen in the persons who are uh, going to depressed, or they are thinking that they will not find a solution. Okay, so here mostly nowadays are tension type headaches. Okay, tension type headaches. So it is due to the overthinking, due to the abnormality of things that can be assumed by themselves. Okay, and third thing is due to the using of electronic devices like phone, laptop. Okay, so always sitting in front of electronic devices which harms the eyes, and due to that work the headache is most common nowadays. But sometimes the headache is reasonable also sometimes. Okay, so it will be a reason, there is a reason behind the headache more than depression or tension. Okay, sometimes we know the name is migraine. Migraine is also most common. Okay, and sometimes unknown cause, the patient, whenever she or he is resting position, they doesn't have headache. But whenever they started working, uh, like reading or going outside or mingling with some more people, so the headache will start gradually. Okay, and sometimes there is a reason behind the headache. It is due to the problems in the body, infective type. Okay, or sometimes a head injury. Okay, sometimes there is an issue in the vessels, blood vessels. Okay, and sometimes due to the headache is due to the hypertension. Okay, sometimes the headache is due to the issue in the brain like lesion, tumor. Okay, hyperactivity of brain cells. Okay, so these are the secondary reasons, what we will call secondary reason. Primary reason and secondary reason. Primarily the headache due to the tension type headache is most common. Okay, and the second is migraine. Okay, and third one is unknown reason. Fourth one is whenever the person is going outside or doing some work. Okay, so, attached with some people, so there is a reason is uh, doing any work or exertion, we call exertional. Okay, these are the four types primarily. Secondary reasons are maybe due to the infection in the brain or in the pathway of the brain. Okay, or any infection in the body other than CNS, central nervous system. Head injury is also the most common secondary headache, or Blood vessels issue means there is no circulation to the brain. Okay. Blood vessels issue. Sometimes you can see that hypertension, which leads to narrowing or constriction of blood vessels will happen due to the increase in the blood pressure. A large amount of blood will flow to the brain. There are small arteries, arterioles, so capillaries maybe will burst. Okay, that is the reason also behind uh, headache. Okay, and due to the bursting of the arteries, the blood flow outside the arteries, blood vessels, so it leads to headache. Okay, and last is lesion. Lesion or brain tumor. Tumor is the reason behind the headache. So you can have to ask the patient, okay, so in which category the patient is fitting. Sometimes the headache is due to the sleep, insomnia also, long time insomnia which leads to headache. Okay, so these are the reasons behind headache. We have to examine the patient in detailed way. Okay, next thing, headache. You have to will discuss detail about all types of headache, how the headache occurs in CNS medicine, central nervous system medicine. But here we have to examine the patient, we have asked the patient. So is there headache occurring here is frontal part? Okay. So we have the frontal part, parietal part, occipital part, temporal part. Okay. Or else it is the pathway of orbital sometimes. So we can ask the patient, the pain is whole frontal region. Okay, frontal region, or it may be parietal region, it may be temporal region, okay, it may be occipital region. So here with this, you can assume that something will get you. So it is affected, okay, it is affected, or some part of the brain is affected, okay, or else some issue is present in this area, in this lobe. Okay, so here as a anatomical structure, an anatomical structure, anatomically you can assume. Okay, so where the pain is coming. And the fifth one is orbital pathway, orbital pathway means here the eyebrow, near the eyebrow. Okay, so this pain may be mostly referred for there is a disorder in the eyes, or maybe sinusitis issues. Okay, or maybe the patient will be have cold in coming days. Okay, so this is the this is how anatomically you can approach to the headache, and functionally also you can approach the headache functionally. Like one example I will give, that the patient while reading the book, while reading the book, he or she having headache, it means that there is an issue in this pathway. Okay, optic nerve pathway means eyeball. Is there an issue in the optic nerves or optic area? Okay, where the nerves are ending, where occipital area. Okay, likewise, also we can approach to the headache. So primarily, secondary, or structurally or functionally, you can approach the headache in detail. Okay. So with that, we will get the basic idea. So how the patient and what type of treatment you have to give, or it is in our hands or not, or else he need something uh, radiologically, or we have to advise basically basic investigations. With that, with investigations only, we can assume the problem. Okay, primarily, secondary, or structurally, functionally. Structurally, functionally defect occurs, it means there is a big issue in the brain. Okay, you have to need diagnosis, proper investigations. What are the investigations? Primarily, you can do. Okay. So basically, you have CT brain, which gives the hard structure or any hemorrhage, any bleeding in the brain, which leads to headache. Or else sometimes you need MRI brain, but most of the time all these are normal. If there is no emergency or acute issue, all of the time is normal. When the person is normal, having all the functions, okay, he's doing his daily activities, but he or she has having headache. So at the time, this is the normal thing. Okay, so what we can assume that here we can assume that the person is having headache due to the primary reasons, not secondary reasons. So the primary reasons can be treated with the help of medicine, but secondary reasons need some type of investigations, and according to investigation, we have to approach the patient. In the primary, or sometimes what will happen in the primary, secondary, both, the patient blood pressure will be decreased in some cases, like hypotension. Okay, in hypotension, the patient also feel headache in this region mostly. Mostly, the patient of having hypertension or hypotension, they will feel the pain in this area mostly. Okay, temporal or temporal occipital area. Okay, so now we'll talk about the treatment plan in electrohomeopathy. So if this is a due to the tension, we have to treat the depression, depression issue. Okay. And if you have the migraine, you have to treat the migraine. If the patient having sleeping issue, you have to treat the insomnia. If there is unknown reason, symptomatically you can treat, or else you have to do pulse diagnosis, which organ is affected. Due to that organ, the patient having headache, like blood making organs, blood utilizing organs, blood filtering organs, or else blood lymph making organs, lymph utilizing organs, or else lymph purifying organs. So there is an issue. So mostly if there is unknown reason, we can assume that there is an issue in the lymphatic organs, mostly endocrine. Endocrine issues are more in female. If the patient is male, you can assume that the patient having sanguine related issues, blood related issues, blood temperamental issues. Okay, but mostly you have to diagnose with pulse diagnosis, and you will get the exact picture which organ is affected. Externally means here, whenever the patient is doing external work, reading, going outside, mingling with friends or family members, then started gradually the headache is started, and it will go on the peak level after 4 to 5 hours. Okay, this is the external regions. Okay, so so we have to ask the details about the patient. Now we'll talk about the treatment plan in electrohomeopathy. Remedies. So basically, we have for CNS, we have two types of remedy, three types of remedies: F1, F2, WE, and sometimes S1. We can assume because we are treating headache only, not the particular type of headache. So I will give the normal prescription. Okay, not for migraine, not for insomnia. It will work for basically for all the purpose. But when you diagnose with anything, you have to need specific thing to treat the disease. So primarily, we can take F1, WE, okay, for nervine effect to give the nervous system, central nervous system, okay. Or else sometimes what happen, the patient will complain that whenever I'm getting the headache, my face become red and the my eyes become red, okay, and have anger issues whenever I have a headache. So means here the blood temperament is affected. Mostly blood utilizing organs means CNS is not getting enough amount of blood to utilize. So brain CNS is exploring his function with the help of pain. So here you need proper circulation to CNS. So you can use A3 here, F1, A3W, or sometimes F1 in the place of A3. You can use A1 also sometimes, but here A3 is okay. Second thing, you're giving the enough amount of blood circulation to the brain, but it need metabolize. It need the brain need to catch the bloods. Okay, so we need to give here metabolic remedy also. Some we need S10, F1, RE. Okay, you can use here also RE, no issue. So if he is going to hypotension, you can add A1 here. If the blood pressure is normal, you can use A3 here. Here S10, F1, RE also. All in initially you can start with D5 only. Okay. So this is my opinion. Basically, whoever patient come to your clinic, initially start with D5. Then observe the patient where he is going. He is going to the chronic condition, or else he is coming to the he is only he is in the acute condition. Okay. So here S10, F1, RE. This is the second remedy. And the third remedy is S1, L1, WE. Because we need to focus on the lymphatic channels also. Sometimes what will happen that brain is receiving blood, but sometimes brain is not receiving enough amount of lymph because lymph also needed by the brain. So we are improving lymphatic channels with this S1, L1, W because we know that L1, S1 is lymphatic remedy. L1 is also lymphatic remedy. W will maintain, or sometimes you can use as is BE also. BE or BE or I. No, yes, but W is enough, I think so. Okay. Here we can take F1A3YE also sometimes because the pain is aggravated. We have to need to calm down. We have to calm down it. So initially F1YE or F1A3YE use, when the patient, the pain is normal, now we can improve the circulation to the brain. Okay, so these are the three remedies you can use to the patient, and fourth remedy for application. Always give application remedy to the patient, in my opinion. That is basic remedy, that is F2WE. Or in severe condition, you can add S1 also or A3 also. S1, F2, S1WE or L1WE or F2. Okay, this much. Okay, for you can apply to the top of the head. So already studied the 45 in the 45 points at the top of the head. So you have to apply and you have to tap like this. Okay, it will absorb gradually. So this is the electro-homeopathy treatment, and you need to absorb which you need to absorb that you need to observe that of the what is the reason behind the pain. Okay, you need to observe what is the reason behind the pain. So you have to immediately advise the patient, please stop doing this work for some time. Okay, and these are the things, basic things we studied about headache. Okay, so these are the basic things we understood about headache, and we need to evaluate headache. What is the reason behind? Okay, and primarily, secondary, or functional or structural reasons. So when you get the reason, you will understand how to treat the patient. Another thing I have to add, if the systematic reason is there, I already told you that when you do the pulse diagnosis, you will get to know which organ is affected. And the cause is liver. So initially, we have to treat both central nervous system and liver. So we will make the protocol like that, which treats liver issues also and central nervous system also. But after second prescription, we have to focus on the liver only. Okay. If we do the pulse diagnosis, okay. So if the problem is in digestive system, so initially we will give the digestive remedies and CNS remedies also. But in the second or third prescription, we'll focus on digestive system. So likewise, we will make the systematic issues remedies. Okay. So I hope you understood about headache. Okay. Sometimes there are the symptoms. Okay. Here I am not giving the symptoms because migraine have different symptoms, insomnia have different symptoms, other different headache have different symptoms. So we will talk in CNS issues when we will talk in detail. Here only I am focusing on headache, how to approach the headache in this common disease. Okay. So if any doubt, you can ask. And the question is you have to answer what is headache. Okay. Headache. And secondary is how many types of headache is that are there and how to approach that. And last is treatment plan. Okay, this is the question for tomorrow.